If you have lower back pain, keep your ice in the freezer. That back tension that flares up from time to time for no good reason is created in the soft tissue and the muscles around the lower spine. Applying moist heat therapy dilates the blood vessels, increasing the flow of oxygen and nutrients to your muscles. Heat also stimulates the sensory receptors in the skin, decreasing the transmission of pain signals to the brain. Also, when you stand, gravity pulls your spine downwards, compressing the discs, the vertebral bodies, and the nerves. When you invert, the spaces between the vertebrae are enlarged and separated. At home, try backflying. Lay face up on your bed, lower your torso down, and let your head hang off the bed. Extend your arms to the floor and relax your body. Your doctor might suggest an inversion table where you're literally suspended upside down, giving your backside some temporary relief.
Well, those are a great start, and chiropractor Christine Hoffman is here now with 3 more tips, along with Alexandra and Leslie, who both are suffering from back pain. I want to welcome all of you to the show.
Thank you.
But before we do get started, I do want to remind everyone at home, we're talking about common stiffness and back pain. We're not talking about pain symptoms that require immediate medical attention. If you have weakness or numbness in your arms or legs, bowel or bladder incontinence, after a major trauma you're experiencing back pain, if you're at extremes of age or you're suffering fever with that back pain, go get seen. But so much back pain is just that typical, what we call musculoskeletal strain.
Yep.
So let's do the first tip, which how to prevent it in the first place.
That's right. Well, honestly, proper ergonomics and stretching are key to preventing low back pain or neck pain and shoulder pain. Alexandra here is going to demonstrate a very simple exercise that we can do at home, and it doesn't cost a thing. It's the best part.
So just a towel.
Yep.
I like that.
What we do is we take a towel and we fold it lengthwise, roll it up tightly, and put rubber bands around the sides here so it holds it together.
Okay.
And then I'm going to have Alexandra lay back along so it's just under her shoulder blades, and we're going to put her hands behind her head, let her elbows fall wide so we get the stretch through there. We're going to take a deep breath in and draw your belly towards your spine. And then lift slightly and slide forward ever so slightly. Let your head hang over the towel like so, and it'll help the muscles to release there.
And you just hold that position for how long?
And you hold that position, you can hold it for 30 to 60 seconds and just really help the muscles to relax and to open up through here. Now, if you're still having neck pain or it's getting worse or, it's just not getting better, then you can, call a chiropractor. And what we will do is we're going to look to see if the cause of the pain is coming from somewhere different, if it's coming from the spine. And we can determine this by how well you turn and bend. And if you excuse me for a second.
Show me what you do. And this is Leslie who's suffering from back pain, so this is something you might do for folks who have musculoskeletal back pain.
Leslie is kind enough to demonstrate for me. And what we're going to do is look at her leg length and look for a discrepancy greater than 1/4 inch, which Leslie here actually does have. So this tells us that something is off.
Okay.
So then we're going to go up and we're going to, palpate for where the adjustment actually is located and where we need to perform it. But I definitely feel an area where she could use an adjustment right here. So I'm just going to go ahead and do that. And just relax for me. There we go. She's resisting me a little bit, so I'm going to use what's called an activator, which is a spring-loaded handheld device, which delivers a low-force, high-frequency thrust. I can get it this way.
That's called the activator?
The activator,
okay.
Yep. And this is easy on her because it's she's not going to resist it. So.
Okay, and so those are adjustments you would make if someone comes to you and you notice their abnormalities like this. Leslie, could you feel anything there?
Yeah, I could feel a difference. It took some stress off my back.